Kia ora koutou. My name's Ian. I'm Chief Executive of the Veterinary Council, for those who don't know me. Also on our presentation side today, we have Dr. Seton Butler, our professional advisor, and Justin Connolly from Deliberate. Justin will introduce himself in a bit more detail in a bit. So first and foremost, welcome. Thank you so much for joining us this rainy in Wellington afternoon. I hope it's better weather wherever you are. Next slide, please, Justin. I'll talk you through what we're going to do today in the next hour. So we're going to talk a bit about our emergency care review this afternoon. We'll start by talking a bit about why we're doing this, which is me, and then we'll turn over to Justin to talk about the work that's been done and the findings from our work. Finally, we'll talk a bit about how that aligns with other stuff that's going on in the sector and the plan from here. So just on format type stuff, we're going to try and whiz through the presentation in about half an hour or so and use the remainder of our time to answer questions, have discussion. So what we'd ask is that if you have questions as we're going through, please use the Q&A function in Teams. It should be up the top or on the side. There should be a Q&A button. You can put questions in there. Please also feel free to vote on other people's. We'll try and focus, or thumbs up, I think you do. We'll try and focus on the most popular questions first, so the more thumbs up, the better. There is also chat available. We'll keep a loose eye on that, but we'll be focusing on the Q&A for questions and discussion. So feel free to use the chat for whatever, for fun stuff. Hopefully not too much horrible stuff about the presenters. So let's get moving then. So just the next slide, please. So why are we doing this? So I hope everybody who's here is aware the Vet Council was neck deep in a review of the emergency care system, so emergency after hours in particular. Why now? So we know that emergency after hours has been a problem for the profession for a very long time. I think Kristen from NZVA mentioned, if you go back to NZVA president speeches from the 1960s, there's commentary in there, we really need to nail this after hours problem. Fast forward 60 years, there is still a problem. It's been a long-standing chronic issue for the profession. However, something shifted in around 2020. We had a pandemic and we ended up closing the border, which meant our flow of new vets dried up very suddenly. In 2019 or so, you would see about 2/3, so about 200 out of our 300 new vets each year coming from overseas. The border shut for a couple of years. That made a major impact on our supply of veterinarians in the country. Now, obviously, the border's open again now, and we are seeing improvements in terms of the number of veterinarians practicing. But it's still got a long way to go in terms of improvement, and that shortage made it very clear that we do have a very acute problem with covering emergency after hours that we need to figure out. So in light of that, in light of the shortage and the stress that was being placed on veterinarians and veterinary business to try and cover after hours emergency care, we decided to launch this review. We got started early last year. And we'll ask Justin to speak a little bit about what we did and how. Why did we take the approach we did? Why didn't we just jump straight into solutions? Well, I've been at Vet Council 8 years now, and I've spoken to a lot of people about emergency after hours. And as much as a lot of people will tell me there's a simple solution to this problem, the challenge we face is that for every person I speak to, there's a different simple problem and a different simple solution. So we're very aware that the challenges in emergency care are very different depending on who you are, where in the country you are, what sort of practice you're in, what sort of business you work for. All of those mean that the challenges of after hours are actually a whole bunch of different challenges that are interconnected and connected to a lot of other things, like the veterinary shortage, like the way we charge for services and the way we remunerate our staff. So, and those are just a few factors. But what became very apparent very fast to me when I joined Vet Council was that this challenge is complex and interconnected, and we decided that we needed a more holistic way of tackling this problem rather than jumping straight into action. I'd also note that the emergency care after hours is something, and Stephen and I have been travelling around the country for the last few weeks talking to veterinarians about this, and what is abundantly clear when we talk to people about emergency care after hours is that it is very much connected to the sense of veterinary identity. There's a strong sense by most veterinarians, I think, that this is a very important part of what we do, a very important part of the service that's delivered, about the relationship with clients and the core values that drove a lot of people into the profession in the first place. So this is very much something we really need to nail and improve. I've talked enough. I better let Justin start, or we'll go over time. So I'll hand over to you, Justin, to introduce yourself and talk a bit about the work we've done.
Thank you, Ian. Kia ora koutou. My name's Justin Connolly. I'm the director of a company called Deliberate. And that is just a small specialist consultancy that does qualitative research and applies systems thinking tools to help people understand complex problems. And the systems thinking approach is the approach we've taken in this work, and I'm about to talk you through. I acknowledge that I work across a range of industries, and this was my first engagement with the veterinarian industry. So I just want to acknowledge it's been a real pleasure getting to know that. But I guess I bring a perspective from a range of industries and a methodological approach rather than deep knowledge within the industry, and which is why we have worked with a group of people within and across the country to do that, which I'll explain. So I have the perhaps not unchallenging task of giving you a very quick crash course on what systems thinking is, or certainly what I mean by it when I use that term, and condensing the journey we've been on and the insights and tensions that have come from that. But first of all, I just want to start with who was involved. So Council recognised that this was a very broad challenge. So they curated a group of people that broadly represented the vets within the industry. I don't know if some of these people are online today. It's great if they are. Welcome. And all of those attendees in our workshop sessions were vets. So that perspective is recognised. It was coming from a vet's perspective. But we deliberately sought to get a variety of vets from different species, different practice types in terms of sizes, different geographies and different geographic settings, so from around the country and urban and rural. So if you don't physically see yourself on the screen there, hopefully you can see people who would be similar to you or bring a similar perspective to the perspective that perhaps you are bringing. There was pretty good representation from the geographies around the country, sorry. And so a pretty good spread of all of those sorts of perspectives. So I guess that's the first thing we wanted to highlight, that this work has come from vets. It has not come from council. It's a key thing in the approach. The next thing is just a quick couple of minutes on what is systems thinking. So systems thinking is a term that gets used a lot, and it means lots of different things depending on perhaps which methodological perspective you are coming from. From my point of view, what is a system? I draw strongly from this definition by Donella Meadows. A system is a set of things, people, cells, molecules, or whatever, interconnected in such a way that they produce their own pattern of behaviour over time. So the key things there are interconnections, how things are interconnected and related, and how they're producing some kind of trend over time. So it's about understanding a causal, or building a causal understanding of how things are interconnected, which you see there on the left-hand side. We kind of call that system structure, more or less of A leads to more or less of B, leads to more or less of C. But taking that articulation of causality, which is often linear, A leads to B leads to C, and then interconnecting them all to understand how they work in a circular fashion, feeding back on each other. And understanding that causal structure helps us understand how things trend over time, or how behaviours change over time, which is the graphs on the right-hand side. Now, system structure is made up of three core components: feedback, delays, and accumulation. Now, these would be fairly familiar concepts to people, but I just want to whiz through them real quick because they're quite important to the diagrams that we're about to talk through. So first is feedback. So just recognizing, as I was saying there, that causality can be circular. It's not just linear. A leads to B leads to C, but C also can influence back on A and or B. Delays, just recognizing a time difference between cause and effect and how that can influence how issues present. Often an intervention or a change or some kind of remedial action you might take some time to present. It takes 5 or more years to train a vet. It takes X amount of time to become accredited or registered, etc., etc. And accumulation, and we like to use the simple analogy of a bathtub, just to talk about and recognize the concept of where things build up or where things might decumulate or reduce. So, water gets into the bathtub through the tap and it only goes out through the drain, and how that level of the bathtub changes over time links back to how your trend of something of interest may be changing over time. So those are the 3 core components: feedback, delays, and accumulation. The feedback loops are the basic building blocks of the diagrams we're about to show you, and the insights that came from that are based on those causal diagrams. And there's 2 types of feedback loops. There's a reinforcing feedback loop and a balancing feedback loop. And so a reinforcing feedback loop, I find that ecological and biological audiences normally understand these really well. So I appreciate that most people in this audience will probably get this pretty well. But a reinforcing feedback loop is something where you have some kind of condition which prompts some kind of action which reinforces that original condition, right? So you'll end up with spiraling type behavior. It might spiral up, it might spiral down, but it will spiral if not impeded by anything else. And that is a reinforcing type behavior. A balancing feedback loop, on the other hand, is one where you have some kind of condition that prompts some kind of action, which balances out or tends to cancel out or seeks to cancel out that original condition. So you'll end up with some kind of goal-seeking or oscillating type behavior. So that's the crash course. The process we went through, I want to talk about because that was very important as well. We had a workshop process, so we've talked about who was involved, and we obviously curated them from around the country. And we brought people together for 3 workshops in Wellington over the course of a few months. So it was from the end of last year through to the start of this year. And we had in between those 2 rounds of those participants bringing along some of their colleagues for a discussion online in between with myself. So perhaps the perspective that they were representing, maybe that was a species type perspective, largies or smallies, or maybe it was a practice type perspective, again, a larger or more rural or urban, whatever it was. They were bringing in a few people. So there was the list of people that I showed you involved with the workshops, and in between a more informal opportunity for some other people to come along, hear what we had talked about, and provide some feedback as to things we may have missed or things that resonated really strongly. So that worked quite well as our process. What came out of that, I'm going to show a slide of some of the things that came out of that in a rough working sense. Don't expect to be able to read this, but I just want you to get a sense that we went through quite a bit of interrogation and discussion within those workshops, working through things on the walls, post-it notes, all of that kind of stuff, drawing graphs and connections and things of interest. Lots of brain dumping, lots of filtering, lots of sorting, and lots of discussion. We then got the vets into different groups to exploring how some of those causes and effects were interconnected. That's the stuff you tend to see on the right-hand side here, the yellow post-it notes, and how they were contributing to the issues being experienced. How we tended to structure that as a discussion was we started off with what we called the symptoms of the emergency after hours care. So, and we used that as a way in to discuss the issues. Seaton provided a really good analogy, which I'll probably capture slightly incorrectly, but he was talking about a multi-morbidity patient. And so these things on the left were where we started. So we were talking about the things that were presenting as symptoms of tension or frustration in the provision of emergency and after hours care. And we talked about the welfare of the actual emergency patient. We talked about client expectations around what emergency after hours care would be. We talked about how the number of vets, so the hours that vets were able to contribute to the roster. And we talked about the financial viability and the financial impacts of that stuff. We then went through a process of building the causal diagrams, and after the workshops, we reflected on those and found we got to 4 potential indicators. I'm using as a very loose term. I'm not suggesting these things are, become kind of keystone metrics within your industry, but importantly, moving the conversation from the symptoms through to what are the more constructive things that we can focus our discussions on and get those into a more healthy state. And those were the things you see on the right. We have the confidence and competence of vets delivering emergency and after hours care. And really importantly, that's both technical and non-technical skills, which I'll come back to in a bit. There's a willingness to do emergency and after hours, which is itself kind of partly a function of the shift frequency and other things as well in terms of welfare and lots of other pressures on vets in that regard. So there's a shift frequency and well as the financial viability component of the business. Now say component of the business there because you recognize that for some that's completely their business if that's their speciality. For some, maybe some have outsourced it completely, and for others perhaps there's a component within the business, or perhaps it's part of what they do within the business or the practice, but it's not actually represented as a separate business unit or anything. It might just simply be a separate line on a spreadsheet or a separate line on a spreadsheet in somebody's head. So that's a summary of how we got into the conversation and where we ended up. I want to now move to the causal diagram that was developed. So this is a qualitative diagram, and I warn you before I bring it up, it's quite comprehensive. You've possibly seen this on the website if you've visited the review stuff, so it's the same one we see there. But this is the diagram that we ended up with that captures all the interactions between those symptoms and those challenges and those tensions that we were talking about in the provision of emergency and after hours service. Really importantly, this is the simplified version of that diagram. So those that were involved might like to talk more about that, but there is a slightly more detailed version of this, which has been simplified because the detailed one is wonderfully comprehensive and useful, but perhaps a little too busy for communicating to an audience in this sort of forum. So we've gone for this simplified version. Now, the insights and tensions identified during this work, I want to cover now as well. Now, on the on the website and the Vet Council website, there is a couple of videos which explain this causal diagram. I'm going to play the second one of those now, just because I could talk through it, but it's time and effort has gone into explaining that really succinctly and really well. So I'll just play that in a moment. It'll just start off a little bit kind of part way through because it's the second video, and the first video sort of just explains the stuff that I've just explained to you. And so just if it sounds like it's sort of starting part way through, that's all it is. So this is just cutting to the insights from that video.
And negative ways. We highly recommend watching our first video on how to read this diagram to fully understand what has been revealed through this work. The diagram has 6 themes that give a comprehensive picture of the whole system. While the tensions and insights have been collected under 6 themes, we discovered that there were 4 areas that were central to achieving a better equilibrium for vets, their clients, and animals in the delivery of emergency care after hours. These are confidence and proficiency in the technical and non-technical skills required to deliver emergency care, the willingness to do after-hours shifts, ensuring that the frequency of shifts is appropriate, and the financial viability of emergency care after hours. The work needed from the themes that we're about to discuss will flow into improvements in the 4 areas above. Our map is complex because it truly illustrates the many factors that have contributed to making the delivery of after-hours emergency care challenging for the profession. As we take you through the themes, please remember that most things that we're about to discuss are interconnected. The feedback loops show where different issues are either reinforcing each other or acting in the opposite direction to balance out the impact. Firstly, let's take a look at the interrelationship between confidence, proficiency, and the willingness to do emergency care shifts. From the diagram, we can see that emergency care decision-making skills are grown and developed from doing emergency care shifts. This builds confidence and competence. Non-technical skills are also highly important in dealing with clients and the financial aspects of the business. These apply here and in many areas of the diagram. Confidence and proficiency in emergency care, willingness to do it, the frequency of shifts, and vet well-being are strongly linked. They all improve or decline together. In developing that confidence and proficiency, we have found that professional development in practices is critical. This is particularly true for developing non-technical skills in less experienced vets and students. In this part of the diagram, it shows that a practice's ability to mentor is constrained by the number of experienced vets on staff. Mentors take time to grow, and improving mentoring will take time. Stimulation at work, vet well-being, and job satisfaction were frequently raised as tensions in our workshops. Here it shows that a high frequency of after-hours shifts increases the stress on vets to maintain the roster, and well-being is closely linked to job satisfaction. So, low well-being and low job satisfaction means that vets are less likely to want to contribute to the roster. Perceived remuneration differences between colleagues, other practices, and even other industries can affect job satisfaction and well-being. A problem with emergency care after hours is that remuneration varies across the profession. This can make it difficult to compare staff or jobs and potentially impacts on job satisfaction and well-being. Another area that we explored under this theme is that a vet's stimulation from work can plateau. As a result of this, they may pursue an area of special interest to compensate. This reduces general knowledge in the practice and increases pressure for more vets to cover the emergency care after-hours roster. Fatigue and anxiety were also found to play a part in the equilibrium of the system. There was fatigue in terms of overwork, but anxiety was also influenced by the level of confidence in non-technical skills, such as the ability to deal with conflict, fears of liability if they don't provide non-emergency care after hours, and payment issues. Tension was also identified between the level of service that vets believe is acceptable for emergency care after hours and what clients expect. Ironically, if vets continue to provide a high level of care or emergency care for patients that do not require it, they will continue to reinforce client expectations and potentially nudge them higher. This overworks and fatigues vets, reducing their well-being. Bringing clients' expectations to a more realistic level, as hard as that might be, helps to restore the balance. This includes changing clients' expectations that they always need to see a vet when another member of the team would be appropriate. Ongoing advances in medical technology are also increasing client expectations of what they will receive for their animals. Realistic expectations also need to be set for this in the context of emergency care after hours. Lastly, we will take a look at the part of the diagram that focuses on financial considerations. The financial sustainability of the system is critical for vets to be remunerated properly and for emergency care after hours to be viable. Vets can feel pressure to discount fees for a number of reasons. For example, because they think clients can't pay, they live in a small community where they know everyone, or they think that the patient will suffer if the client can't or won't pay the proper fee. Pet insurance is one way to reduce the likelihood of fee discounting and prompt appropriate vet fees. While those factors are about changing fuller fees, some clinics share outsourcing emergency care to reduce costs and the burden on their business. Here we see the lower the financial viability of the emergency care part of a practice, the greater the likelihood of needing to outsource or share emergency care between practices. Trust between practices also affect the likelihood a practice will share or outsource emergency care after hours. This is very much like a chicken and the egg situation, where if there is no trust, you are not likely to share, but trust can be built through sharing the service. One of the key areas to improve financial sustainability is to make clients aware of the true cost of veterinary care, reducing the likelihood of conflict over fees and incidents of discounting. It also reduces anxiety for vets. For more detail, you can read the full report on our website. After watching this video, we would really like you to visit the Emergency Care Review survey and give us your feedback on what you've seen. We'd also like to know if you think we have captured all of the issues affecting the delivery of emergency care after hours, and if not, what else we should be considering. Once the survey period ends on the 31st of July, we will use the feedback we have received to help inform the final emergency care review report and the actions that will come from it. Thank you for your time.
Now, the last slide there referred to the survey closing on the 31st of July, but that is, of course, still open. This webinar is part of that engagement around sharing these insights with you and giving feedback on them. So that survey is obviously still open. But the other comment I wanted to make about that little video is hopefully that you could see or sense yourself or relate to different parts or multiple parts of the things that were being described in there. Ian said at the beginning around how many people had a very a clear view of perhaps what the problem was and what a solution was. And they could often be summarized as some of those different parts of that diagram that's just been explained. And it's important to note that obviously the point we're trying to make is all of those things are interconnected, and perhaps some might present more strongly for some practices of some areas, of some geographies, or some species. But others might present more strongly for others, or different combinations of all of those. And affecting one obviously affects the others. The survey that was discussed covers these 6 themes that were shown in the diagram, and just asks for some feedback on some of these specific areas within that. I won't go through these in detail now because they're on the survey and the website. And that's the place to perhaps get that feedback. But just to recognise that those themes are covering those 6 areas around confidence and proficiency, client expectations, the financial considerations, the medical knowledge and training side of it, the professional development and mentoring, and really importantly, that well-being, that stimulation that vets get from work, the well-being they have in work, the job satisfaction, all of that stuff. Before handing back over to Ian, I also wanted, and Ian Seaton, I just wanted to provide a few reflections from myself as someone who's a systems thinker, used to thinking in systems, but also an outsider to your industry. So respectfully and collegially, I hope to provide a few comments. There's three key points I'd like to quickly make. First, there is no silver bullet. Right, in terms of we're often looking for a single thing that we can do to make our problem or problems go away. Sadly, that doesn't exist, but there are lots of silver shotgun pellets, right? It's the best photo I could find for silver shotgun pellets. But the point I'm making there is, there's not going to be a single action that can be taken, but there are lots of little things and lots of interrelated things that can be pursued. So I'd encourage you to look for those. The second point I wanted to make is that when dealing with complex systems, often the things that are in your control or your area of remit might not be the most influential to have an influence on the system. So it's less about you and that's kind of othering. It's your fault, somebody else. It's more about we. How can we navigate this? What can we do? And that's very much a theme of the feedback that the council is seeking, and also recognising that the council as regulator can't necessarily intervene in many of these areas that we have talked about or recognised as being important in this diagram. And the third point as well is just to make the point that there is no blame in terms of these causal connections that exist. We have described them, we've articulated them, they exist. How they came to be doesn't really matter in terms of perhaps some of the history or how some of that stuff came to be. So it's kind of important to not look for someone to blame. It is what it is, and how do we navigate forward? Those are my comments and reflections. And thank you for the chance to talk about them. I'm going to hand back now to Ian. We have a section around how some of this aligns with the Vet Association, which who aren't on the call, but Ian can speak to. So I'll just bring up that slide. Thanks.
Thanks, Justin. And I know, Kristen, I think I saw you on the call, so please do chuck in the chat if I get anything horribly wrong. But I don't think I will. So those who've been to the conference and came to our session would have seen this bit. But I think key points here are that one, yes, the NZVA are doing some very good work around the same topic, emergency after hours. And we're working closely with them to make sure that our two sets of work align and don't work in conflict with each other and don't overlap too much, if that makes sense. Next slide, thanks, Justin. So NZVA, many of you will have participated in this survey back in 2022 that highlighted some of the key challenges facing those, facing those trying to deliver on emergency after hours. Those are summarised there. Feel free to check the NZVA website for more info on that. We'll keep moving. Thanks, Justin. And so Kristen and Sally did some excellent work mapping their areas that they identified from the survey and left there to our themes that we identified through Justin's work. So I don't know if this transitions, Justin, if we can show the rest of that. Sorry, this is the NZVA, sort of this is their work streams and the work they're doing. And then the next slide takes you through how that maps against the work we're doing. So we feel, and we've worked quite closely with NZVA on this, that they line up nicely. Certainly when we come to the next steps for us, it'll be very handy to be able to point to the work NZVA is already doing and see how that aligns. And again, make sure we're not doubling up. Thanks, Justin. Which brings me to next steps for Vet Council. So as Justin mentioned, the videos and things do say we're going to close on the 31st of July. We decided that just wasn't enough time. Seek and I have been travelling around the country talking to different communities about this topic and about the workshop findings. If you're in the South Island, we'll be in Timaru, Dunedin and Invercargill next week. Please do come along, and if you are close to one of those localities and haven't heard from us and think you'd like to come along, please drop a line and we'll send you the details. It'd be great to see you there. Bearing that in mind, we've got this webinar out, we're going to close the feedback on 31st of September. That should give everybody ample time to digest all this content, go and read the report, fill out the survey. So please do that. After 31st of July, 30th of September, we will be working to collate that information. So we've got over 200 responses so far. So it'll take us a little bit of time to collate all that, turn that into a final report and share that with our council and stakeholders, as well as the profession. But I'd expect to have something out to everybody well before year end. And a crucial part of that will be the action plan, which we know is what counts really. The journey is important, but the actions we're going to take are arguably more important. So Justin mentioned, this is not something that Vet Council can do on our own. I fully anticipate and expect there will be plenty of work for us to do, and we will be committing to that. But we will also be looking to others to help. Be that the NZVA, MPI, Massey, folks like VPIS, but also individual veterinarians, veterinary businesses. We're going to need help here, especially when we're talking about some things. One of the topics we talked about a bit over the last few weeks has been that client expectations piece and the irony that we found in the workshops, that it tends to circle up. By meeting client expectations, veterinarians' practices are unintentionally driving those expectations further up, which is a bit of a vicious cycle. To reset that, there's things that Vet Council can do, and so can NZVA. We can send the message, this is what you should expect after hours. This is what good care, acceptable care looks like. But we'll need veterinary businesses and veterinarians to deliver that same message through their actions. It's all very well us setting limitations for what people can expect after hours, but then if you can take your cat in with sniffles at 2 a.m. to get looked at for a non-emergency, that undermines the message, right? So it's an example of how we're going to need to work together as a profession and as a sector to make meaningful change. Okay, 5 minutes, so that's probably enough from us for now. So we've got the Q&A function running. Please do get typing, ask us your questions in Q&A, and we will try and keep an eye on chat as well. And if we don't get enough questions, we'll just sit here in silence for 20 minutes, which could be fun as well. So Stephen, you're online. We might start with the first one, Justin, which is, one for you, comes from Sarah. Considering our need to educate clients about veterinary costs and client expectations, How has your exposure to the vet profession affected your previous opinion of it? Any thoughts on that, Justin?
That's a wonderful question.
It
He
is.
says to give him time to think about an answer. The comment I need to make is I'm actually not a pet owner myself. I have been a pet owner. I know, heaven forbid. I hope that doesn't disqualify me.
You should have
from
told us that
working with
before we
you.
took you on.
So it has changed my perspective, but I wanted to give that caveat because I didn't really have a pet owner or client sort of perspective of the veterinary industry from being a heavy user, if that's the right term. But it has certainly helped me appreciate just the complexity of your business, like most businesses that I tend to have the pleasure of working with. It has helped me realize, certainly the workshops, we joked about it at the time, that you are a very solutions-oriented, very action-oriented industry, profession, and that is a nature of the way that we are trained often, not just vets, that's just a life thing. But it has absolutely given me the confidence that you can align on working through some of these issues together, I think, in terms of, I think there's definitely quite the attitude for that, and absolutely the competence for it. But it kind of just comes down to an attitudinal thing, I suspect. And I'm certainly now, in what I like to euphemistically call barbecue conversations, helping reset client expectations amongst my friends who have animals. So I'm doing my bit to help your profession a little bit, I hope. I hope that is a decent answer to the question. Thanks for it, Sarah.
Thanks, Sarah. Thanks, Justin. It's very pleasing to hear you doing your bit. Appreciate it. So no more questions at the moment.
Oh no, they're responding in.
There is? Okay. I can't see it, so maybe you can ask for us.
How many complaints per year does the Vet Council receive with regards to after-hours call-outs?
That's a very good question. So it might help to start with some definitions here. So for those who don't know, if you make a complaint to Vet Council, we have to put it through our complaint process, right? That's what the law says. We don't love that law, but it is what it says. So we tend to think of things coming through the door, be that a phone call, an email or whatever, as an inquiry first or a concern. And we'll do our utmost to triage those and make sure we deal with them appropriately. Not everything coming in needs to be dealt with through the complaint process. And in fact, we find very few do. So, we put a lot of time and effort into triage, as it were. So when we get to actual complaints, we might get 20 to 30 complaints a year. Of those, again, it's quite small, so it fluctuates quite a lot. We might see 2 or 3 that are sort of broadly about after hours. Of those that go to disciplinary hearing. So we have maybe 1 disciplinary hearing every 2 to 3 years, maybe. Again, it's very small, so it fluctuates a bit. But I can say confidently there has not been an active disciplinary outcome with regard to after hours ever. It's not what we consider a disciplinary matter. A key part of that is because our complaints committees are made up of 2 veterinarians and a layperson. So you've got two veterinarians who have done after hours, who know the challenges of it, looking at what's reasonable. And we have good precedent that making decisions after hours is hard, and that there is a wide degree of latitude to veterinary judgment in those situations. So, long answer to a short question. The answer is very few that actually go through the process. Quite a few that are inquiries, but we do tend to deal with those quite actively, and very few of them go much further than that. Where we had concerns about delivery of after hours, and sometimes that'll actually be practice telling us about another practice in the neighbourhood, we'll try and deal with that practice directly, not through the complaints process, but more collegially. And we find that tends to be more effective in actually improving the situation and forgive me, Justin, fixing the problem. Does that answer the question, Stephen?
I think that's a pretty comprehensive sort of summary. Yeah.
Oh, cool. We got a bunch more. Okay. Gosh, where to start? If you want to pick one out, Seton, you've probably been paying more attention to me.
I was wondering about that new vets, junior vets one. It's in the chat, not the Q&A season.
Okay.
Oh, okay. I didn't see that one.
Yeah, there's a couple that have jumped over. So I'll perhaps read it out and attempt an initial bit of response, but I think it'll partly come from you guys as well. So has anything been considered to specifically support new vets / junior vets in doing after hours? I'm particularly thinking of cases where an employer may be telling falsehoods or setting expectations higher than VCNZ would establish, i.e. employers tell young vets to attend the Snuffly Cat at 2 a.m. because that is the clinic's best client. So my comment on that is that sort of tension is exactly a micro example of the sorts of client expectation stuff that bubbled up in the workshop, and we've definitely represented that and captured that within the diagrams at quite a aggregated level, and then perhaps hand over to Ian Seton around expanding on the appropriateness or not of council being involved in that space or not, and in terms of how difficult it is to mandate that or not.
Yeah, so I'll jump in a wee bit there. Difficult to mandate. I think starting point is code expects veterinarians to attend emergencies. Emergencies are life-threatening or situations of unreasonable unnecessary pain and distress of an animal. So that's the expectation on the I guess the mandate, but the expectation in the code. Where there are situations where the service delivery is above and beyond that, I think it probably starts falling to a practice or client policy situation. I think, though, these are some of the conversations we need to have, because council can set the minimum, but it's unlikely to be able to set something in between that or above that, so that it applies to everybody. So typically we would take the position of where we are, which is it's an emergency, you should attend or must attend. Everything else is a decision for the team. But coming together as a group, I think we need to better define that, because now we understand or have a better appreciation of that spiraling, winding up of client expectations. It does seem inevitable that is going to break a lot of people. So, at the fear of letting some clients down, maybe that's part of this process where we can try and find a level playing field. Ian, do you want to add anything to that?
I think you've nailed it, Seton. I mean, I think there's a few factors here. One is specific support for new and recent grads, and I mean that is crucial here. Is we need to make sure they are supported, that we're not driving them out of the profession in their early days in those formative years. And some of the key loops in the diagram we've developed, indicate that there is a trick to developing confidence and competence in after hours, and exposure is an important part of that. But I also think a nuance we can't quite capture there is that it's exposure in the right way, right? It's not, for many vets, it's not throwing them in the deep end and seeing if they sink or swim, because many will sink, and we fortunately or unfortunately we don't have enough vets to do that. So there is work to be done on enhancing new grad support, getting some industry-wide agreement on what is appropriate, but also recognising that it is somewhat personal as well. Some personalities are much more confident and able to take that on earlier than others. I think the question about being able to say no to the Snuffly Cat or whatever is a very important one. And again, that's part of the skill set that we need to develop in people doing after hours. I think it's a problem for new grads and the whole profession. I mean, we've over the last few weeks, we've talked to plenty of senior vets who admit to seeing things they arguably shouldn't after hours. And I think some of the work we're going to need to commit to as part of this as a profession is setting some standards, agreed standards on what's reasonable to see after hours and what we should all be agreeing to say no to. I say we, unfortunate, you should all be agreeing to say no to with our support. We might keep moving because there's a lot of questions.
Yes.
So I'm just going to cherry pick a few that I don't think have been answered much yet. There's a few we'll hopefully come back to if we have time. So the shortage of vets, I assume, is largely due to a lack of retention. How is that being addressed, and how much is emergency after hours a factor? And is there a distinct difference between large animal, small animal, equine? A lot of questions there, but I think I'll start, and Seton and Justin, feel free to jump in. I think I saw John on the call, and he'll be pleased for me to reiterate that I think retention's a funny word when we're talking about numbers in the profession. So if we look at the data we do have, which is a few years old, and we're doing a new analysis at the moment, retention in terms of people with a practicing certificate is actually pretty good in the vet profession. I mean, you're probably talking, 85% after 10 years. So that's in line with other professions, given the modern world we live in. That's pretty good. What may not be so good, we don't have good data on, is retention in clinical practice, so at the coalface, as it were. We don't know as much about that, but it certainly seems like that's much more of a challenge. And I know the Boehring NZVA paper a couple of weeks ago noting that very few veterinarians want to maintain, in their career in clinical practice. I think we do need to recognise that non-clinical careers and roles are important and are vital to the profession and to the industry and to the country. So we need to recognise that those are valuable and those aren't people who are lost to the profession. But we also need to do more work on making sure that clinical careers are valuable and valued, and that there is a clear pathway and sustainable career there for people who do find meaning in continuing clinical practice, so that we don't lose so many to other careers and other parts of the profession. So that's an ongoing piece of work. Part of the work we're really doing is data gathering and analysis, but I know NZVA are doing some work around retention in terms of clinical practice as well, and I'm sure more work will be needed. I'm sure after our shifts are a factor in that. And to Justin's point, I think some people love it, some people tolerate it, and some people won't do it, right? And we need to find a way to make after our shifts tolerable for most of the profession if this is going to continue. And that's a case of, some of the factors that we've identified, making them worthwhile doing, but also making them of an appropriate frequency. And finally, yeah, absolutely, we're seeing a lot of difference between small animal, large animal, equine. By and large, we hear from production animal that it's not as much of an issue. I'm not making light of it, but it tends to be quite seasonal. It tends to be very intense for a shorter period, and then there are chunks of the year where you're doing very little. And we don't hear a lot of large animal practitioners saying this is unsustainable. It seems to be a pattern most can live with. Smallies is quite different, particularly once you get out of the centres with big shared after hours or after hour centres. So if you're in a mixed or even purely small animal, but in a rural, semi-rural setting, that seems to be where it's the most hard, and it's the hardest to attract staff. And equine's also very geographic, correct me if I'm wrong, Stephen, but I think, we've talked to regions in the last couple of weeks where it's almost impossible to cover after hours or even day time in terms of equine. But there are other areas, particularly, around the Waikato, where it's, it's relatively well staffed and manageable.
Great.
Anything to add there, Steve?
No. I think you're absolutely right. I think there are some pinch points, and the biggest tension seems to be provincial New Zealand small animal and specific areas of equine, where there aren't enough veterinary resources available. Can I just quickly say, because there's quite a few questions, if you've got specific questions that you feel didn't get a chance to be answered or want to explore it further, either pop it in your in the survey questions or email myself directly, and we can try and get some sort of position on whatever your question was. Can I read the next one? This one here. Oh, sorry, do you want to say something in?
What I'm just going to say is also, please do keep asking, because what we might do afterwards is collate these questions into a document with some key answers, so that if we can't answer them, if we can do it, and you can find them online. But yeah, keep going, Steve.
Okay. Okay, next one I've got here is, in terms of direct availability of vets after hours, this is from Kate, sorry. Do you think creating more distance in, i.e. answering services, vet service, triage services, etc. would help? How do other industries that offer 24-hour service manage the reasonableness of the call out? So there's a couple of things. I'll jump in and answer a few, and then Ian and Justin, if you have any additions from other industries that might be useful, Justin, if you've got any experience. So the code allows for capable non-veterinarians to answer calls after us. And look, my experience in companion practices, I seldom answer the phone in the middle of a surgery. There's always someone in the team doing that, and they're very capable and competent. they're doing it during the day, and they tell me someone's coming down in 5 minutes. Well, no, I put them off for 3 weeks because it wasn't an emergency and it suited them. I'm trusting them, so why wouldn't I trust them to do it overnight? And there are triage services, so either people from your own team, and I know I'm aware of a few practices in New Zealand that have had the same person doing it for 20 years, and I'm very, very happy that they've had that in place. But there are now remote online triage services available, and certainly they're perfectly feasible and useful. The other ways that we're hearing excitement and activity in are regional shared after-hours services, where whatever the model you set up, multiple clinics are either dedicating to a single clinic or rotating the shifts around between the clinics. Certainly there have been conversations while we've been on the road in the last 2 or 3 weeks where clinics are looking to try and do that more and more. And that is going to, I think, help centralize and coordinate the type of delivery that you as a region are prepared to deliver. We've been talking about, maybe these regions thinking about what might be reasonable distances to travel. Those sorts of things are coming up as part of conversations, and trying to align practices within a region about how they're going to try and not standardize, because I don't mean standardize, but coordinate similar and like-minded thinking on how they're going to deliver after us. Other industries, the obvious one is human health, and there are 24-hour. Ian, you've probably got more experience in this than me. 24-hour helplines for people, but they've also got charity-funded ambulances and very, very stretched human healthcare services. So I don't know if anybody's actually got it nailed. Ian, you might have another view.
Yeah, I mean, ironically, human health. I mean, we're seeing the news after hours clinics are closing all over the place. I mean, Waiheke now, it's much easier to get animal care after hours than it is human care. So I mean, it's ironic. Perhaps also ironically, industries that have maybe nailed this, plumbers, electricians, you want one of them after hours, the way they've nailed this, they just charge like a bugger for it. It's obscenely expensive to get them out, and that seems to work quite well, which is food for thought. In terms of that question about, the distance, adding a bit of separation between the clinician and the caller, I think I love that as a concept. I think it's key in terms of taking some of that moral dilemma off the veterinarian, who's going to be very, I think the default and a bit of the, what comes with being a veterinarian is a lot of folk will be keen to see it rather than not, whereas somebody whose job it is to triage is often quite good at that. I also really like, as a tool, things like VetChat or the online, the online tele-triage services where clients have to pay a fee. I think that brings in an element of self-triage. If I have to pay $40 to get through the door, I'm going to think about whether this can wait till morning or not. And I don't see anything wrong with it. I think anything like that adds a bit of distance, adds a bit of triage into the mix is really, really helpful.
Can I add to that, Ian?
Yeah.
There's no reason why a veterinarian sitting at home can't triage a call and charge someone $40 and say, no, I'm not coming out, but that's $40.
Totally.
Why not? You're having a consultation, just happens to be a form of consultation, a triage consultation, but you're making a decision. That's your professional opinion. It's worth minimum $40 if it's at midnight. I don't see why we wouldn't be charging that ourselves. Now, okay, you don't want to be woken up and bill somebody for that. That's fine. But today you could do your own triage and charge people for online triage information. Sorry, have you got another one, Ian, that you want to?
I'm just seeing from Anthony, is the following issue going to be addressed? What's an acceptable distance a person needs to travel to access an after-hour service? Just to note, look, this has come up a lot, and I suspect strongly it will be part of our action plan is confirming that. So a bit of background here. I mean, Vet Council for a long time has said, look, there isn't a fixed distance, but for example, you can look at what's reasonable in the circumstances. For example, human health might be a good comparator. In Wellington, for example, which is what I know, you might be on the Kapiti Coast, you might be a good hour away from a human healthcare service, and so why would we expect more in terms of animal? Why can't they go down the highway to the after-hour centre and Kaifara. In other parts of the country, it might be, particularly rural areas, it might be considerably longer than that for human healthcare. So again, it's reasonable to expect people to drive for their animals as well, or wait if it's an ambulatory vet in a large animal situation. That doesn't always work out. There are differences between human and animal health, obviously, and I think what some people asked us for is, look, it would be great. Yeah, that's great, but it's a bit weaselly. It'd be great if you could actually just put a line in the sand for us so we know what's clear. That's a double-edged sword, right? So the minute we do that, people hold you to that standard, and that might not be reasonable for some folk. But I think there is work we can do in terms of setting a standard. Perhaps that's a regional standard. Perhaps we can work with regions to say, look, what can you reasonably expect in our neck of the woods compared to Central Auckland, compared to West Coast of South Island, for example. So to answer your question, yeah, look, I think it is going to be addressed. I'm not exactly sure how yet, but we do need to nail that. 3 minutes. Cool. Anybody want to try for a last question, maybe?
Yeah, there's another one. Oh, sorry, so you go. You go.
I was just going to say, do you mind if I chip in a little comment that perhaps kind of touch on a range of questions? There was a few there around. I mean, the distance was kind of one. There was one that you were talking about, sort of the regional sharing components, Seaton, around how to deal with some of that stuff. One of the comments I wanted, and there was a question there around, can you assess what sort of proportion of people might be leaving clinical practice because of the after hours stresses? So kind of drawing a thread through loosely through a range of those things. I guess the point I wanted to make is there was definitely the sense that the after hours stresses were contributing to people leaving clinical practice. Having said that, I'm a qualitative researcher, I can't quantify that. But having said that, if you took this work that we have done, which is through the lens of emergency and after hours service, if you remove the emergency and just kept the causal diagram that's been developed, all of these issues relate to the industry and practices in general. So I think it's important to make the point that whilst we're looking through the lens of emergency after hours care, it's actually a whole bunch of things which are probably more than likely affecting other elements of business practices, the profession as well. Don't know if that's hopefully that's useful. Like in terms of the point I guess I'm making is don't get too narrowly focused on the emergency after hours care component of it. Lots of these insights will be quite applicable across a range of things. That was my attempt at sort of answering a bunch of the questions that were coming up.
Yeah. So we will go through all of these and try and produce a bit of an answer sheet to all of them. I just want to briefly touch on in 20 seconds. Mark's asked a couple of questions to do with, what about businesses that aren't providing after hours for whatever reason? So short answer is that we do actually have a good process for dealing with those in-house. Vet Council does, if we know about them, so please do raise them with us. We can and do deal with those businesses. What we perhaps haven't done so well is it described how we do that and how you can raise those concerns. So that is a piece of work I'm doing with the complaints team at the moment to be more clear about what our enforcement policy is. But long story short, if you're aware of practices that aren't meeting their after hours obligations, contact us. We can't do anything unless we know, and once we do know, we don't let go of it. We do take action on those. Although I appreciate for some it might not feel like that outwardly all the time. We're about a minute to go, so we might wrap up there. Again, thank you so much to everybody for your time today. Great turnout for a webinar at a lunchtime midweek, so very much appreciate that. This will be recorded, so you can go back and watch it in slow-mo or fast-mo, whatever you like. Share it with your friends, please. We will take these questions that you've all asked and produce a Q&A section on the website answering some of these, so please do look out for that. If you have other questions or comments, please do contact us. The easy way is via Vet Council. Just put emergency care review in the topic and it'll come to me to deal with. Otherwise, you can contact us directly. Better yet, you can fill out the survey and that's the easiest way for you to give us feedback on this work and directly have some impact on the action plan that's coming out of this. Okay, so we'll call it quits there. Thank you so much, Justin, particularly for your time today and for everything you've done on this project. We couldn't have got anywhere near as far as we have without you. Thank you to Seaton for your insight today and to Cherie for managing everything. And again, thank you to all of you for coming. Have a great rest of your day.
Kia kite.
Yeah, kia ora.